So you've got us again for 1 minute. We just wanted to really quickly just give you a bit of a run through on some work that's been happening for the last sort of 18 months or so. Within the OT department, it was identified that our previous cognition guidelines were well and truly out of date, quite a few years out of date. And so a working party consisting of Ron and Eva McDonald up front here, and myself was put together to review our previous guidelines and update them. So we went through and did some review of the literature, did some benchmarking with other health services, went through and reviewed the expectations from external services like TAC and work cover and that type of thing, as well as reviewed things like the NeuroList survey and various other sources to develop a document, a guideline. Overwhelmingly from the information that we got was, certainly in OT land, is that we need to be focusing on cognition as a component of overall occupational performance, not so much in isolation to anything else that we might consider in our assessments. So we really tried to tailor the guideline that we put together to really be focusing on that and focusing on cognition within everything else that we look at. So thinking about that in terms of our informal observations during initial interviews, during task analysis, that type of thing. So we separated our guidelines into factors that we might consider just in our general day-to-day interactions with the patient, as well as some specific screening tools that might be relevant to people following on from that initial assessment and identification that there's something further that needs to be looked at into here. Speech have gone through and developed some similar guidelines with a real focus on the communication aspect, as Tracy was talking about earlier. The overall aim is that these two documents will fit within more overarching cognition guideline or management of cognitive impairment within Bendigo Health. That's yet to be established, but that's kind of where we're sitting with the framework. So just to give you a little bit of an idea, these were the kind of things that I think TEES was mainly responsible for putting together in regard to just stuff that we look at whenever we're having an interaction with the patient, and things that might be reported on by family members if the patient's not so insightful about what their abilities are. So that's just some general things, and the details of those are listed within our cognition guidelines so that therapists have a really clear understanding about what they need to be looking at, as well as being able to be clear and consistent within our documentation. So that's the OT ones, and we wanted to go through speech.
Yeah, I'll just add a little bit more. We did go through pretty much the exact same process with the team of speechies, and we wanted to really, I guess, look at, sort of prompted us along to be a bit more consistent in the way we look at cognition, how we assess and diagnose, and that there is the formal assessments. There's a lot to be gained from informal assessments and working with families and carers. So part of our role in the guidelines dictate some of that is that we provide assessment and diagnosis of cognitive communication disorders. And beyond that, we also deliver impairment and functional skill-based intervention. We work with families, partners, friends, carers to provide education and conversation partner training, which I'd love to go through in much more detail, but no time today. And help people get back to communication activities that are important to them, might be work or leisure-based, but really again integrated as part of one of the multidisciplinary team members. While I don't have an opportunity to talk about conversation partner training, I wasn't aware of this TBI staff training website. I've popped it in the link. It's an ABI thing in a lot of mail, and they have this great little tips for talking handout, and really relevant to people with cognitive problems and also all sorts of other communication problems. So that'll be new slides to look through, but around natural communication and trying to talk in a way that's accessible and understanding, and giving people an opportunity to speak for themselves when you can, repeating important information and not changing the topic really quickly. So lots of really good general communication strategies to think about. And without talking through all of them in great detail, these are the kind of things with our guidelines that we look at as speech pathologists. And you'll notice if you look at the two side by side, there's lots of overlap with OT and probably lots of overlap with neuropsych and lots of other professions, which I think just reflects the fact that there's a lot of shared work in the area of cognition, and then some pockets of specialty that we all have, again, emphasising the role we all have to work together. So there's our references, and I think